You have two options in your device in terms of waveforms. You can use a symmetrical biphasic waveform or an NMES waveform, which is neuromuscular stimulation. The treatment approach in this example is using NMES to the weak inhibited gluteus medius muscle of the hip. The mechanism of action is to activate the weak inhibited gluteus medius muscle to stimulate some contraction and incorporate into some exercise programs. The clinical example for today is to facilitate the gluteus medius during a hip strengthening exercise, to be able to combine the modality of electrotherapy with an actual functional movement. Dosing intensity is important. We want to make sure that we produce a strong submaximal contraction to facilitate hip abduction. And as you can see, we want to put the patient into a side-lying position and create the opportunity to do the exercise. I want to point out very quickly, we have the electrodes already in place. We've got the one electrode here and one electrode here. This is how you set up the protocol for this treatment approach. You're going to select electrotherapy, manual operation, NMS, the appropriate channel that you'll be using, in this case channel 1, and we want to make sure that the frequency is adjusted to 40 pulses per second. The phase duration set to 200 microseconds, which is already defaulted to, and an on-off time of 10 seconds on and 20 seconds off. You can see that we already have the default set at 10 for on, so we want to adjust the off time to 20 seconds. So all I'm going to do now is push the amplitude button on the screen to highlight it. I'm going to increase the amplitude. I'm going to ask the patient now to let me know when he feels a strong sensory or tingling sensation. Okay, but I want to continue on to facilitate a strong submaximal contraction to make sure we have adequate amount of stimulation to the muscle belly. I'm going to let him know when it's at a level he can tolerate. I want him to let me know, I'm sorry. Okay, at which point I'm going to push the start button so they can cycle with an on time and off time. And just to ensure that he's focused on the hip and his movements, I'm just going to come over and stabilize his back and making sure he gets good external rotation during that on time.